Do specific gut protocols really fix chronic fatigue, digestive issues? Many people with chronic fatigue syndrome wonder if focusing on gut health can truly solve their digestive problems. While some treatments targeting the gut seem promising, they are not a guaranteed fix. Scientific studies show that protocols like probiotics, special diets, and even fecal microbiota transplantation can help improve some symptoms, but they do not cure the underlying condition. Digestive issues are very common in chronic fatigue syndrome, with over 70 to 80% of patients experiencing problems like irritable bowel syndrome or other gastrointestinal disturbances. These symptoms are often linked to changes in the gut microbiome, which is the community of bacteria living in our intestines. In people with chronic fatigue syndrome, research has found imbalances in gut bacteria, including lower levels of beneficial microbes that produce butyrate. Butyrate is a substance that helps keep the gut lining healthy and supports immune function. When the gut barrier becomes more permeable, sometimes called leaky gut, it can lead to increased inflammation and may influence systemic symptoms like fatigue and brain fog through the gut-brain connection. Some interventions aim to restore gut health. Probiotics and prebiotics are common approaches. Small studies suggest that taking probiotics might improve overall well-being, reduce inflammation, and lessen some digestive symptoms in people with chronic fatigue syndrome. These supplements work by helping to rebalance the gut bacteria and strengthen the intestinal barrier. However, the evidence is still limited, and results can vary from person to person. Fecal microbiota transplantation is another option being explored. This procedure involves transferring stool from a healthy donor into the gut of someone with digestive issues. It has shown success in treating certain gut diseases like Clostridioides difficile infection. In early studies involving chronic fatigue syndrome, some patients reported improvements after fecal transplants, but large and well-controlled trials are still needed to confirm these findings. Dietary changes and supplements are also under investigation. Adjusting what we eat to reduce gut inflammation and support beneficial bacteria may help, but again, research is preliminary. It's important to remember that these gut-focused treatments are not cures for chronic fatigue syndrome or its digestive symptoms. They might help manage some issues but do not address all the complex factors involved. Chronic fatigue syndrome involves many systems in the body, including immune, neurological, metabolic, and genetic factors. The causes are still not fully understood. More research is needed to determine how effective gut therapies are in the long term and how best to use them safely. Any treatment aimed at improving gut health should be part of a comprehensive care plan developed with healthcare professionals. In managing digestive issues in chronic fatigue syndrome, focusing on gut health can be helpful for some symptoms and may improve quality of life. But it's important to remember that these protocols are not magic solutions. Combining gut health strategies with pacing, symptom management, and professional medical advice is the safest and most effective approach. Always consult your healthcare provider before starting any new treatment, and keep in mind that individual responses can vary widely.